早晨，大家好，歡迎大家嚟。
Good morning, everyone. Welcome to our ICON Health Forum, which is conducted in Cantonese. The topic is Stroke Smart.
First, we do land acknowledgement. We want to say that UBC is located on the traditional, ancestral, and ceded territory of the Musqueam, and UBC operations are also on the territories of the Squamish and Tsleil-Waututh. We also like to acknowledge that you are joining us today from many places near and far, and acknowledge the traditional owners and caretakers of those lands.
我係何陳宇慈 Barbara Ho， 係一名註冊護士，亦都係安康健康網絡首席護理主任。今日咧，我係你大會嘅主持人。網上嘅朋友，大家好，歡迎大家嚟參加今日嘅安康線上中文講座嘅。呢個係誰有中風危機，應如何處理？
Now, simply put, I want to give you an introduction of ICON because some of you are first-timers. ICON is an initiative by the UBC Faculty of Medicine, the Digital Emergency Medicine, and the executive director is Kendall Ho. We've had this for 19 years. We also thank patients as partners, as our partners. We wanted to convey reliable and useful information to communities, to the indigenous citizens in BC, as well as family members and patients, provide them reliable and relevant health information on prevention and care of illnesses using technology so that they know how to manage, find technique to manage and lower the risks of having these illnesses. At the same time, we also will provide electronic apparatus, apps to the community to help them on improving health. Now, let's come back to this. Now, none of us knows what lies ahead tomorrow. So let's just think, one day, all of a sudden, you've lost your ability to speak because of a serious illness, or because of a stroke, or because of an accident, or because of some sudden relapse of chronic illness. So we cannot control our speech. We cannot talk. What kind of people know what our wishes are? Simply put, when you talk about eating or paying the bills, who's going to buy groceries for us? Who's going to pay the rent for us? Now, you cannot express that to your family members or your friends. So what can you do? How can you plan ahead? Thank you, Barbara. How can you plan ahead? So our next speaker is Patsy Lam, who is a registered nurse, and she is also very perceptive in this. Thank you, Patsy. Can you hear me well, Barbara? Yes? Thank you. So please advance the slides for me, Anna. Thank you. Now, how's everyone? First, I want to introduce myself. I'm Patsy Lam. I'm a registered nurse. I've worked for more than 20 years in BC. I want to thank Barbara and Minika for inviting me to talk about what advanced planning is. In this session, we're going to talk about a few topics. One is advanced planning, and after that, we'll talk about palliative care, and lastly, we can I'll give you some idea of what kind of resources are there in the community. First of all, now, advanced care planning. There are many kinds of ways to translate that into another language. So advanced care planning, simply put, is ACP. Now, ACP has been highly recommended by many health boards. So what is ACP? Advanced care planning is something that you can consider ahead of time to make arrangements ahead of time, because, like Barbara said, that life is full of unexpected events. So if someone unforeseen happens, advanced care planning can help your medical team, and as well as your decision maker can help you make decisions. So here it says it is something that is actually a time to reflect on your values and wishes. So when we think about medical planning, for example, maybe putting a tube in me or feeding me. So when you think of something so detailed, it's very difficult to predict. So advanced care planning is important because it tells us what to do when this and that happens. So it helps us to make medical decisions. So ACP is not one single event, it's a process. There are many steps that one has to take, and depends on a person's health conditions or their changes in their value system and all that. So we have to go back to what has been planned a few years before, and maybe it's not suitable anymore. So in the next slide, you can see here that, like in life, we have to plan all the time, all kinds of plans from a child. Okay, we also plan for our child, the schooling, education, and then after a child grows up, getting married, buying a property. So not just medically or individually, there are many aspects. Next line. So advanced care planning, like I said before, it's not a single event, it's a process. Sorry, I misspoke. Well, I didn't misspeak in English. It is not just a single event. So it's something you have to think about. You have to think about your personal values and what matters to you. For example, for me, interacting with people is important, or my religious beliefs are important.
Hopefully, there's a process, a pastor or religious person to support me. The second step is to learn about your health condition and how you like to take information. What health problem do I have? Will it continue? Will it deteriorate? How do I receive information? Do I want my family to be with me when I listen to the doctor? Some people will say, I don't want to know anything. Just tell my wife. Different people have different ways of doing. Just that you need to know what to do in order to communicate. The third step is decide when you're able to express your will, who will speak for you to make decision. So you have to find a decision maker, an agent. The person should not have any conflict, and the person will have more contact with you. And this person must agree to be your decision representative. And in BC, there's some law. They list a list of people that could be your decision maker. You may not want to go according to the list. I have a special one representing me. So advanced planning is very important in different forms to be signed first, so that they could be used in the future. The first step is to talk, to discuss important people, to discuss priorities. And the fifth is to record. to say the important things I have said, to record it on paper by video or audio. Next slide. In BC, you can see there's a link, there's a publication called My Voice. It has different versions, including in Chinese. This publication may be downloaded, maybe 50, 60 pages. It has got different advanced planning information and with a very detailed explanation as to what to do. And then there's some blank space for you to write down. As you read, you can think of what comes to mind. You can write down, and you can go to the website and download it. Next slide. Some people say, oh, the publication is very thick. 50, 60 pages is a simpler one. There's a workbook called Advanced Planning, several pages. This is a simplified version. It aims to help people with stroke or with brain injury or people with limited English literacy. I read this. I think it's a very simple and easy to understand, and you can uniform your thinking and do your planning. The next slide. And very simply, I'll talk to you about palliative care. Now I want to tell you what is palliative care. Palliative care is like advanced planning. Is sometimes we interpret it as different, using different Chinese terms, but actually it's all palliative care. What is palliative care? Palliative care is a specialized medical care service. It's not a place. It is a service. It can be provided in the hospital or the patient's home or hospice or assisted living or seniors home, long-term care. The service is aimed to help people with limited life to increase their quality applicable to any age, any race, any religion. People can all access this service. The service is based on the patient's requirement. It will help them with symptom management, also support for the patient's family. Some people may decide to stay at home to get palliative care, and they don't want to go in and out of the hospital. So the home health also will send people to the person's home to support their needs. The patient may have special requirement in terms of spiritual or religion or culturally. They may need more help. They will get support from the palliative team. In the community, there's a palliative care in the community with the nurses. They will provide this palliative care support. Next slide. And then people may ask, how do I arrange for a palliative care service? If you are interested, you need to. People who require this palliative care, you can contact your health authority. You can see there are several telephone numbers based on the patient's address. You can call the relevant number. You can get the medical professional people like your family doctor and specialist to help you make a referral. Next slide. In BC, there's a BC Palliative Care Benefits Program. This subsidy program is applicable to BC resident with active MSP coverage and people who have reached the end stage of life-threatening disease wish to receive palliative care. there's a form that has to be filled in by the patient, the family, and the doctor. Once approved, when it's found eligible, they can obtain the 100% of the prescribed medication. Not everybody gets coverage. The medication in the palliative benefits program, medication will get 100% coverage. Also, the medical equipment and supplies will be covered. Not all. If you need to know what will be covered, you can go to their website to make inquiries. Next slide. Very simple. I told you what is palliative care. I give you some information about this service. There are 3 links. The first is Advanced Care Planning Information Booklet. Is provided by the palliative care, meaning the third one. Actually, it's a website that provide many palliative care support information, including information on the planning. You can go to a website. This advanced planning booklet has got 20 odd pages. It is in Chinese and many other languages. More information, more understanding. Hopefully you get. If I want to know more about palliative care, or specifically what service my home health authority provides. There's a homepage, Vancouver Coastal Health. If you're in other health authority, you can go to the health authority that's in charge of your area. You can enter the relevant name of the health authority. Palliative care service provided by each may be different, meaning how to call in to get your service. You can go to the website to make inquiries. Next slide. The last page is the BC Health Link BC. This is a telephone number every day, 24 hours a day. It can provide the health information every day. The last one is the Family Caregivers of BC. This website provides information to caregivers, like when they have workshops or expos, so caregivers could get more information online. That's the last slide. Thank you, Barbara. Thank you, Patsy, to explain to us the services and also advanced care planning. You can stop, pause, and think to see if you need to do any advanced arrangement, or if you want to know more about this information, you can go to your home health authority to make inquiries.
Here we have the ways to contact us icon. So if you have more questions, you can either send them by email at iconproject.org, icon.support@upc.ca, or Facebook and other media. And we also want to thank the Ministry of Health, the BC Ministry of Health Patients as Partners Initiative for their continuing support. So after we have listened to the presentations, we have acquired a lot of knowledge about stroke. Stroke is preventable, it is recoverable, and it is curable. So now we have imparted knowledge in the community so that they can reduce the risk of suffering these critical illnesses. I hope that you can spread the information to other people, and you can also view these presentations again in future after they have been posted. So I hope you enjoy a healthy and happy life. Thank you. Bye-bye.